Hi, I'm Lacey Knight. I'm going to be doing an IV start today. This is the room that I'm in. Actually, let me just make sure all of my papers are side down. This is my countertop. This is my workstation area, and I have this. This is my MAR. It's left out and somebody spilled on it. So, prior to coming into the room, I would look over my MAR and my orders, and I would make sure that any assessments or labs that needed to be drawn had already been done, and I would look those over as well. I'm going to make sure that there's a medical necessity, and there is. So the doctor has ordered an IV start, and I'm going to go ahead and come into the patient's room. I would use my hand sanitizer and clean my hands. I'm going to introduce myself. Hi, my name is Lacey. I'm going to be your nurse today. Can you please verify your name and date of birth for me? And as the patient is doing that, I am going to make sure that my MAR and the patient's name and date of birth match. Shirley Coast, 5/14/1998. Shirley Coast, 5/14/1998. Wonderful. Thank you, Shirley. Okay. So today I am here to start an IV. The doctor has ordered an IV because you are slightly dehydrated. Stress fluids. We're going to have you on this IV for until it's been ordered to be discontinued, and it's just some extra fluids, so support for you. Do you have any questions? No? Okay. So I'm going to go ahead and get my bed to a comfortable working level. Probably move that bed up so that it's nice and comfortable for me. And then I'm going to go wash my hands. And get my gloves on. I have brought all of my supplies, gathered my supplies, brought them into the room and set them out already. I also have my waste receptacle and my sharps container here, so those are ready to go as well. Okay, so I have my gloves on. So the first thing that I'm going to do is I'm going to do my first medication check on my saline that's been prescribed. I'm going to follow the 7 rights of medication administration, check that against my MAR. It is the correct medication. It's the right dose. We'll be setting that in the pump. It's the right date. It's the right route, the correct patient, and the right reason. So everything looks good there. Now I'm going to go ahead and open my, I wouldn't push that into the trash, but the trash needs to be thrown out. I'm going to open my saline. I'm going to look at it and I'm going to kind of squeeze it carefully, make sure there's no leaks, make sure there's no holes, make sure it's clear, there's nothing floating in it, and it is not expired or discolored. Everything looks really good with this, and it is the right thing. So we're going to go ahead and we'll set that aside, and I would open my all of my tubing, IV tubing. We ran out of unopened sets for this video, so I'm going to use an open set. I do have my lids, but all of this would be aseptic, and this would be clearly unopened if this was a real patient. That was not an option for me today. So I have my tubing. I'm looking at all of my tubing and it looks good. I'm going to go ahead and, excuse me, my nose is itchy. I'm going to go ahead and prime my tubing. Got my cap on. Got my bag. I'm going to flip my bag over. Carefully take my lid off. We're going to make sure that this stays aseptic. So lids stay on. They do not touch anything except for each other. Spic goes in to my bag. My tubing stays up. I'm going to push some of the air out, and then I'm going to flip my bag. I'm going to hang it while I prime it, just to make it easier. I am going to also make sure that my cassette is closed before I do that. My cassette is closed so that the saline does not come out. And then I'm going to squeeze my drip chamber. I want it to be just under halfway full. Maybe a little more, so somewhere in there. And then we're gonna go ahead and prime the tubing. So to prime the tubing, I'm gonna make sure that my clamps are both open, my roller clamp and my cassette. And I'm going to open my cassette. And because this has been used, I'm going to close my cassette. And I'm going to have to pull some air out of this line. This would not be something that I would do, but I have to do this because this is where we are. So I'm gonna go ahead and see if I can get it started by that, or if we need to go lower. Once again, my apologies for this. I would not be doing this. I had the supplies. Okay. So I'm getting my tubing primed, and it's like there's an air bubble in there, so I'm just kind of pulling. There it goes. Okay. So I'm getting my tubing primed. Making sure I'm not wasting any. Set the lid on, and I've gotten the saline through the tubing. Got my cassette closed again. And now I'm gonna check my tubing for any, just making sure my camera's still working. Checking my tubing for any bubbles, bigger than a champagne bubble. And I don't see anything. As I come to each port, I'm gonna just flip it. We're making sure there's no bubbles. There are no bubbles in that one. I'm not seeing bubbles here. This looks pretty stinking good. I don't know if you can actually see that on the video. Gonna invert my port. There's a little bubble in there, so I'm gonna loose, get my bubbles coming up to the top so that they're released. Wonderful. And I'm going to make sure that the lid is on my IV tubing, which it is. Now we can put the tubing in place. So I'm gonna make sure my roller clamp is closed. Okay. Just almost. There it goes. Okay. My tubing is ready. Okay, so that is good and ready to go. I'm gonna now put my label on. This is per facility policy. And it's ready to go. Label is ready. Okay, so now I've got my short extension catheter and my saline. I'm gonna hook my short extension catheter up to my saline. And I'm just gonna make sure that it's primed. So I'm bringing saline all the way through. I'm gonna open the clamp. I'm gonna push enough saline through to make sure it's primed. It is primed. We don't wanna waste. We don't wanna make sure there's no bubbles. No bubbles. We're gonna clamp it. And that gets set aside with that. Okay. I have all of that finished. So now I'm going to take my catheter out. Make sure, first of all, I'm gonna make sure that, not my catheter, I'm gonna make sure that all of my IV prep supplies are out and ready to go. So I have my supplies ready. Just gonna use a couple things from this start kit. Most of it I already have. I'm gonna use that. We will use these. Okay, the rest of that can just go there. I have some tape here that I've prepped as well. I'll do another piece. Okay, here's some tape. We are ready to go there. Okay, so I am going to let the patient know that we're gonna put this tourniquet on. I'm gonna feel for a location as proximal or as distal as possible. So we're gonna go down here. I'm gonna release that tourniquet. And the alcohol. We're gonna clean the area. Then we're gonna allow that area to dry completely before we do anything else. Just loosening that lid. Okay. So area is completely dry. I'm gonna retie my tourniquet. Get my needle out and ready. I'm gonna anchor the vein just below, and I'm also gonna anchor just above. Let the patient know that they're just gonna feel a slight poke. My bevel is up. I'm going in along the line of the vein and at a 15-degree angle. Go in. Okay, I've got a flash. So at this point, I'm gonna go half an inch more or a quarter of an inch more. Yep, oh, we do. We actually have saline coming in, so that is a flash. So now I'm gonna loosen the catheter from the needle as I push the safety, and I'm going to advance the catheter all the way until it is flush with the skin. And then I'm going to slip the needle out the rest of the way. And I'm going to put my safety on, throw my needle away, and take my tourniquet off. Okay, at this point, we are gonna pop the lid off of my primed tubing here, and we're gonna check for patency, check to make sure everything looks good. I was putting some slight pressure up above the catheter just to make sure that we weren't losing blood. And then I'm gonna do 3 to 5 mils for patency, which attached right there. 3 to 5 mils. I'm gonna clip again. I'm looking for signs of infiltration. I don't see any. It looks very good. Everything looks good. It's exciting. Put that lid back on. Okay. Oops, it looks good. I'm still stabilizing my hub. And now I'm going to take my Tegaderm. I'm going to go up to the, just stabilize, sticking myself to the patient, stabilize the catheter. I'm going to put one piece of tape over the hub as well. Move this wristband. And we're going to put a label for facility policy on that site. Now I'm going to do my third medication check. Checking, making sure 7 rights of medical administration or medication administration, everything looks good there. We're also going to be checking the pump at this point, making sure the rate matches the prescription, and it does. Doot, doot, doot. We're going to not touch anything. We're going to hook the patient up. And we're going to make sure that the clamps are open. Okay, clamps are open, clamps are open. We're good to go there. Now I'm going to document everything per my facility policy, and that will vary facility to facility. So we'll document the whole thing. At this point, I'm going to shift to moving from an IV to a saline lock. So I would make sure that I have all of my supplies to do this next skill. And then I would come in, I would assess the site, the IV site, and make sure that it looks okay. There's no signs of infiltration or infection, and it looks good here, which is wonderful. So I'm gonna pause that, and I'm gonna make sure my tubing is clamped, and it is. I'm gonna hold the port. I'm gonna remove the IV tubing. That fits very loosely, but that's okay. I'm gonna remove that for now. And then I'm going to take my alcohol prep pad, which should be over here. So I'm just gonna grab one because I have one and now I don't. My apologies, the phone fell. Okay, just grabbing these. And I'm going to clean. I'm gonna clean my look. Okay, with my alcohol. I'm gonna connect. I'm going to open and flush. And then once I have that flushed and closed, we will tape and disconnect. So, does this not have lid? Okay. So now I have my saline lock is in place, it's patent, and it's time to disconnect my IV. I have my healthcare provider orders to disconnect the IV. So I'm gonna go ahead and come in. I would turn my infusion off, make sure that the clamps are on and the pump is turned off. I would disconnect all of that. This would be also disconnected. And then I would take my holding my catheter, taking all of my plastic off while still holding the catheter. All of the Tegaderm that's sticking to me. I'm going to take my gauze and I'm going to place it lightly. I'm not putting pressure on, just lightly placing the gauze over the insertion spot. And then I'm going to pull the catheter out in one movement parallel to the arm. So I'm going to pull it out and I am going to put pressure and I'm going to inspect the catheter, that it is whole and that there's nothing missing from it. And it looks whole and there's nothing missing, which is great. So then I'm going to take my catheter. My catheter is going to go in my sharps container. I'm going to look at the insertion site and everything looks good. So then we're going to put a new gauze and we are going to cover this up. Good to go there. And then I am going to document per facility policy, making sure to note specifically that my catheter is intact. Yeah, thank you so much.